Good morning. Welcome back to our Safe Together, Strong Together weekly Facebook Live. My name is John Marshall. I'm VP here at Colorado Mesa University, joined by my partner in crime and co-chair, Dr. Amy Bronson. This week we're going to be chatting a little bit about student mental health and the work that so many good folks on campus are doing to make sure that students are getting the care and the support that they need. So Liz Howell, our current VP of Student Services, Anna Lee Walker, one of our great professionals, and herself a provider over at the Student Wellness Center. But before we get to that, been a tough week and around the country and here in Mesa County and at CMU. So I want to chat a little bit about that and talk about the context in which we're dealing with things for COVID-19 this week. Nationwide, we are seeing numbers running. You can look at a variety of news sources, Johns Hopkins, the New York Times, and others that do a good job of tracking this, but it doesn't take long to realize that numbers nationally continue to grow and grow aggressively. Here in Mesa County, unfortunately, the pandemic has finally arrived. We have had for some number of months the blessing and benefit of having a really low virus burden here in Mesa County, but those days are gone. The last several weeks have been really pretty tough in terms of the number of case counts here in Mesa County. We are seeing by probably a factor of 5 increases in community spread. Just a few minutes ago, Mesa County Public Health released an upgrade of, I guess it would be a downgrade, maybe more appropriately, of our dial, meaning we've gone from the safer at home level blue. Now that's been moved to a level orange based on the fact that these numbers are really screaming in Mesa County right now. I know we've had a lot of conversations about the fact that as a campus, our success is in part based on the context of the community that we're in. And right now those numbers are growing and it is having an impact on us as a campus. We anticipate this will be the largest number of cases we've had this week, all semester. Now, to put that in context, we might take a quick minute. Mesa County and CMU have been working hand in hand this whole time. If you look at the number of tests that Mesa County has performed all through basically since the beginning of the pandemic, but for our purposes, semester to date, you can see that we represent about 20 or 25% of the total number of tests, right? And yet we only represent maybe 11 or 12% of the positives. So proportionally, we remain one of the safest places, even as cases are growing, we remain one of the safest places in the state and here in Mesa County. But it is inescapable that as the Mesa County cases have risen, so too are our cases. And the reason we're seeing that is basically the exposures from our students as we do our contact tracing work. Roughly 3/4 of those exposures are coming from the community right now. So I think, Dr. Bronson, as we reflect on this, probably going to have to redouble our efforts, increase our communication with students, and all of us taking an additional measure of care and an additional measure of precaution as we head into the Thanksgiving break. The good news is we have 2 weeks left. We can do this, but I think we all need to be really clear-eyed and so reminded about the fact that case counts are growing in the community, in the nation, and here at CMU. And so I wonder, the other trend that we've seen, Dr. Bronson, if you might just take a moment and chat about, we've had a lot of good discussions, right, with medical providers and public health professionals this week about acuity and virulence and things like that. Would you take a moment and just remind us all about the trend that we're seeing both nationally and here at CMU?
Yeah, absolutely. You know, it's an interesting piece as we look back at when the pandemic began last spring and the hospitalizations and really the acuity, meaning how sick people really were when they were contracted COVID. We saw some really sick people. You know, people talked about like it was a really bad flu. There was a lot of hospitalizations, a lot of people on ventilators. We just didn't have a lot of the treatment strategies that we also have right now. And what scientists are really saying right now with what's happening across the nation and really what we're seeing anecdotally here in Mesa County is that those that are getting COVID, many are still asymptomatic. Some may have a slight sort of runny nose, a little bit of a cough. But really what we're seeing is the virus is becoming more contagious, but less virulent, meaning people are less sick or less acuity, meaning not having to go to the hospital, not having to seek a lot of care. They're able just to kind of sit at home, run it out. But we're seeing that it's transmitting much more readily, which I'm going to take a few minutes because I like to geek out on a little bit of science and a little bit of virology. And if you think about it, viruses are pretty smart. And when they think about wanting to stay around, they like to jump from healthy host to healthy host. And in order to do that, in order to continue to stay alive, they want to find a new host. So if they don't make the host quite as sick, that host may want to and feel like they're okay to go to work, to go to school, and more readily transmit that disease to someone else.
Now talk for a minute. I know that we are talking, of course, about generally our student population who tend to be healthy 18 to 22-year-olds, but not all of the population has the same level of risk, right? Maybe talk about why it is that we care so much about the behaviors of our students because of the impact that they may have on the community.
That's exactly right. So it's all about the vulnerable populations, right? And it's so easy to remember, or it's easy to forget that we're all so interconnected in our community. Yeah. So even though you are a young and healthy person, the decisions and choices that you make, and then potentially the circles that you then interact with, could be someone that's connected with working at the nursing home. Yeah. And we introduce it into that population, and then we really see rampant spread and really a high morbidity, or a lot of people dying from this. So I think it's one of the most important reminders that we can put out there, and being a good community partner is doing those things, A, to keep yourself healthy and well, but remembering why we wear the mask, why we wash our hands, and why we do the social distancing, because it's not necessarily because we're trying to keep one another safe that are in this healthy population, but it's really thinking about being good community partners for those that are more vulnerable to what this disease could do.
So as we think about this, and I want to talk about Thanksgiving here coming up in just a minute, but one of the things we continue to find is that, as we pointed out with some of the sort of estimations and graphics we've shown you, is that while the community spread continues to be really strong, CMU continues to be one of the safest places out there. Our random test continues to show very, very low infection rates, right? We have very few positives on the random, which is truly a snapshot of the COVID burden on campus. And we continue to be able to use our wastewater testing to effectively get ahead of and see early growth in some of these residence halls. That is the wastewater, as we've said probably a few times on this platform, is that it has been one of the maybe most encouraging or most pleasant surprises that we've had in terms of how effective that strategy has been for us as a campus. So much so that we have deployed an additional 4 test collection sites. And so we're now going to have eyes on a additional cluster of residence halls. And so coming here into next semester, I mean, obviously we'll have a snapshot in these closing weeks, but just as importantly for second semester, we're already thinking about spring and really trying to make sure that we've got our eyes as clear as possible about what's happening on campus. And so on-campus residents continue to be among the safest anywhere, really. And we're really pleased to see that wastewater continue to expand, continue to have success. Not to say that we've got our arms wrapped around all of the science of it. We continue to learn every day what that means, but it certainly has been a very, very helpful and effective indicator.
Absolutely.
Heading into Thanksgiving, Dr. Bronson, what do students and parents and others need to know? I know parents are probably happy to see students coming back home, but yet we know a lot of travel coming into this holiday represents some level of risk. What do students and parents need to know heading into the Thanksgiving break?
Yeah, it's a really great question. I think one of the things that we have really started talking about on campus, we really talked about culture coming in and how do people understand what is the pandemic, what are viruses, how do we protect ourselves, and more importantly, how do we protect those that live with us and around us? And that continues to be true as we continue to shift that focus to now going back home for Thanksgiving, and really helping to empower students to say, you've learned a lot while you were here on campus about how to keep yourself safe and how to keep others that you live with safe. Now let's start thinking about that and pivot as we start thinking about returning back home for Thanksgiving. what are the things that we need to start thinking about right now in order to not only keep ourselves safe, but to think about a really good strategy for return to home to keep your community at home safe as well. So that may be, right, thinking about isolation, quarantine, a testing strategy. And maybe you can just talk a little bit about some of the ideas we've been throwing around to help students start thinking about that planning process.
Yeah, I mean, these are smart young adults. There's, among the most well-educated on COVID-19 anywhere, right? We've done all the classes, we've done all the, regular stream of communication, and our students are probably sick of it at this point. But the reality is going home for Thanksgiving can be a wonderful thing. And getting to reunite with family. We've asked everybody not to travel, all those things. So this is really that opportunity to get back together, but we know there's risk associated. So we can think through a few different strategies here. One might be, as you're returning home, that you go home to a local community that has testing available and go ahead and get tested on that weekend prior as you return home. That'd be one obvious strategy. We won't be able to test everybody here on campus before they leave. Running 10,000 tests in a few days would not be practical for us. But again, this is one of those empowerments of students making their own choices and coming up with a plan that's right for them. Another is really simple, limiting high-risk exposures over the 2 weeks before leaving. And that basically starts tomorrow.
That's right.
So tomorrow starts the 14-day clock before the 20th, Friday, the 20th of November, when students will have the last day of in-person classes here and going home for the break. It really means for students thinking about how to limit high-risk exposures over the next 2 weeks so that when they do travel, that they travel smart, they travel safe, and when they do arrive back at home, they're not further exposing high-risk family members. So that conversation I look forward to. I have a ton of confidence in our students. They have been absolutely amazing this semester, and I think this will be sort of the cherry on top of a successful semester, even in spite of some tough things coming. So lot there.
Yeah, absolutely. I think one last piece before we wrap up, and I want to get to our guests because we have some incredible guests here today. But I think right now, and what's happening in our county and what's happening here on campus, it's really important that the future is now, and the planning that we're doing. There's never been a more important time to have that conversation than right now, when we start to see the cases go up and realize that the infrastructure they've put in place is really what's enabling us to be able to respond and not react. And I think as we continue to plan, continue to optimize, we're focused on these last 2 weeks, getting this across the finish line, but really our thoughts are already turning towards how do we continue to make this process even better so we continue to keep campus safe.
Yeah, and I think that optimization word is key. The future is now phase of our Safe Together, Strong Together effort is very straightforward, and that is build on what's worked, improve upon what's worked, continue to hone and refine what's worked so that we can really deliver a great experience for students safely, keeping faculty safe, keeping students safe, and really doing our part as a community leader here in Mesa County.
That's right. All right, enough with these updates.
Enough with the updates. Time to welcome a couple of our guests today. So today we're joined by our Vice President for Student Services, Liz Howell. Liz is a good friend, longtime colleague, and we appreciate you. Liz, for those of you that don't know this, Liz was redeployed for this academic year to help with student services while the old person fell down on the job and took on different things. So we're so appreciative of you being here today, Liz. Tell us a little bit about you, how you wound up at CMU, how you wound up doing this work.
Sure. Well, thank you for having me. It's an honor, and I appreciate everything you guys are doing. So I grew up here in Grand Junction. It is home. I did leave for a short period of time, came back. My husband and I are raising a family here. We've got 2 young kids. I just completed my master's degree last December. Was really excited to walk across the stage and celebrate. And then COVID hit in the spring, and
Life changed.
Life changed, right. Campus changed, everything's changed. So with all the great work that you've been doing to help us with COVID, I was asked to step in and serve, and this year I've been serving as the Vice President for Student Services. So the best part about that is we have a great team. We have a lot of dedicated people who are committed to serving students, and I just get to help with our team with that. So.
And of course, you're not new to that team. You've been here at the institution for how many years?
Right. So I've had the privilege of working in the Student Services Department since 2012.
Yeah.
So kind of grew in that role, advanced and took on more leadership opportunities here on campus. And then this summer was tapped in as acting vice president for Student Services.
So Liz, you are very familiar with our students. You've been here in this role for 8 years. You've been kind of doing the hard work. This has been a unique year, right? Students are facing some different challenges. They're facing the same kind of things that we've always faced with a whole another couple of layers of challenges, right? Tell us about some of the resources you and your team have helped to make available for students during some of these tough times.
Yeah, so I think it would be helpful to start a little bit with some of who our team members are. So the Student Services team is really all-encompassing of support services outside of the classroom. And I do think it's important to acknowledge that today when we talk a lot about the support services, I'm going to call out a lot of the services that are on our team, but really we have a great campus community that is committed to serving students. So if anything that I mention is maybe not directly on our team, it just is a testament to the fact that everyone on this campus is committed to serving students and is well versed in these resources. So under the Student Services team, we have our Residence Life team that is worked really hard to make sure they're providing a healthy and safe living environment for the nearly 3,000 students who are living on campus. We have a campus safety team that has been busy all semester long, just ensuring everyone is safe and healthy. They've deployed many students on our COVID the CSA team to help with
COVID ambassadors.
COVID ambassadors, thank you. Yes, there we go.
Which is a pleasant way of saying peers who are reminding peers to put their mask on.
To follow the rules, yes, absolutely. Right. We also have our Diversity and Advocacy and Student Health Department. And within these different teams, there are many staff members that show up every day and work really hard to support students. Mm-hmm. So one of the things I want to call attention to is the academic and wellness resources. We had created a page early on in the COVID response days just to call out what these resources are on the academic side as well as the wellness side. And that they aren't just available on person when we've been on campus this semester, but they're all also available virtually for those students who may prefer to have more of those interactions in a virtual setting.
Got it. So Liz, your team is obviously working very hard to support students. Have you seen utilization rates grow over this semester?
Yeah, most definitely. So particularly at the Student Wellness Center, we've seen at least a 20% increase in utilization of services for our behavioral health counseling services. But the other thing that's being reported is just a more intensity of the symptoms and feelings that students are struggling with. Yeah. And that's a lot of things, not just COVID. So, we all just have gone through the election season. There's been a lot of racial tensions this semester, just a lot of things going on in the world. You add academic pressures to that, and there's a lot. Students are struggling. They're reporting increased signs of isolation, lack of motivation issues, really just feeling disconnected. And so we have responded in several different ways. Probably one of the first things we did was add additional providers. So we have 9 different licensed providers that are professional licensed counselors up at the Wellness Center. And so in addition to our Director of Diversity, Advocacy, and Student Health, Bob Lang, a lot of people on our campus community are really familiar with the great work that he and his team do to support students. So we added additional providers, but then we also increased the hours that those providers who were already on staff are able to see students. And we've continued to offer the virtual offerings as well. So students can make appointments by calling the Student Wellness Center. And they could go up and see a licensed provider or make an appointment for a telehealth counseling appointment.
That's excellent. So you talked a lot about these broad-based services that you have, and I know you provided some links for us to kind of go through those. But maybe talk us through a little bit about what are those resources out there and what can people access if they're looking for some help?
Yeah, certainly. So we've talked a little bit about the Student Wellness Center, and that's located up on the north end of campus, up on Orchard Avenue, and students can call and schedule appointments. We have healthcare providers up there. For a $15 copay, students can go up and see a healthcare provider. If it's COVID related, we are asking students to call ahead and not just present in person. But then we also have the counseling services through the Student Wellness Center for a $5 copay. And the appointment wait time is within a week. So if students need to see someone, they can get in with a licensed provider within the week of calling to schedule that appointment. For those students who are really struggling and need immediate crisis care, we do have reserved services to support those students. So anybody who's struggling doesn't feel like they need to wait for a week. We have things to be able to respond immediately to take care of students.
And the difficulty, of course, is trying to help students and staff navigate through how acute, how severe is the issue they're facing, right? So, I think about if I'm a parent, what are the questions I can be doing to ask, things I can be doing to help my student navigate? Is this something I can wait a few days, or are we dealing with a situation where they're really acute? How is it that we chat with parents? How do we empower parents to continue to serve as partners with students?
Certainly. I think what I would first talk to is that they don't feel like they need to navigate that alone. And so just calling the student services office, or for those who are on campus can come see us on the 4th floor of Lowell Heine. And we have people who can help walk you through a series of questions and talking through to get right at that point of, do we need to get somebody today and right now, or is this something where we can coordinate getting you an appointment scheduled in the near future?
Yeah, we all like to get what we want when we want it, but I think recognizing maybe that we have a lot of students out there who are struggling and needing that care, and so trying to be somewhat circumspect and thoughtful about where their needs might fit.
Sure. And the other thing that comes to mind is we have great mentors. So through the Office of Student Success and Engagement on the 1st floor of Lowell Heine, there's a series of success coaches and mentors that can help have some of those conversations with students. And they're trained in recognizing if this is a student that needs more immediate care, getting them connected to that care right away.
That is great.
So some of the other wellness resources we have on campus, we have the U at CMU portal, which is an online wellness portal that students can set wellness goals and work through on their own. It has a lot of resources available through the portal and is branded and connected to CMU resources. So if students are setting a wellness goal to get more connected or get more engaged, it then partners with, say, our student life office and helping share with them what activities, clubs, and organizations and things that they can plug into. It also then would connect them to crisis care if they're going through, have set a goal and find they really need to talk to somebody right away. It will connect them with the campus resources to get someone here at CMU right away.
So we've covered a lot. I know tried to provide a lot of things on screen probably as well, but if I'm a parent and I'm still I'm not exactly sure where I should go, what's the one thing that I need to remember? Where would you point me if I'm just not quite sure where to go to get my student help?
Sure. So I think just call the Student Services Office and we will serve as that place to get you connected with all of the campus resources. We've covered a lot, and if you go on the website, there's a lot of information. But I would go back to my original point that our campus community cares a lot. And if somebody is seeking help and they just ask, we're going to get you connected to the right place. So we would rather call and troubleshoot and talk you through that than have you not reach out for some help. So the Student Services Office is always available. And that would be my first direction that I would point people to. You could reach out directly to the Student Wellness Center or any of the other resources that we've talked about. But really, we can serve as that place of referral. Yeah. We can also work with our other departments, academic affairs, especially we're going into finals and other stressors that are going to present themselves in the near future. I think sometimes people feel like they need to know all of the answers, and we can help walk them through part of that as well.
Well, you have touched on so many amazing things, and I think in a time of stress and unknowns and uncertainty, just really appreciate what you and your team have done to create a culture of caring, even more so for our students, and really giving them that wraparound as we think about health and well-being while they're here on campus. So appreciate you and your team and all that you've done.
Well, thank you guys for having me.
Thanks, Liz.
Thanks, Liz.
I think I would just maybe take a second, Dr. Bronson, and reflect on that idea. I think one of the things that I've always felt like makes CMU special is whether it is a librarian or a custodian or the president,
Yep.
that they're going to take the time and take somebody by the hand and get them the help and the care that they need. And
Yep.
just one of those items that I think makes us proud to work here at CMU.
That's absolutely right. And I think one of those pieces of it continues to bring us back to the why of why we're here. And part of that is the culture and the transformation that we know happens here on campus and the holistic look at students and what we want for them when they're here.
Absolutely.
Yeah.
I see we received a little encouragement from Christine and from Nicole. I would just say thank you for your feedback. Thank you for helping us to get better, and really do appreciate your partnership and support and encouragement. We know we don't always get things right, but we sure as heck try, and we are immeasurably better because of the feedback, work, questions, and support that we get from you all as part of our campus community. So.
That's right. Absolutely.
Okay, so our next guest here is Annalee Walker. Annalee, thank you for joining us. A quick reminder for our friends at home that we all wear masks everywhere here, indoors. Most of us wear them outdoors, but for the one moment while the governor has allowed us to take masks off while we do television appearances specifically like this so that we can communicate well. So for these short minutes, we'll remove our masks and
enjoy the break.
That's right, and be able to see your smiling face. We sure appreciate you coming.
Thanks for having me.
So Anna, tell us a little bit about yourself, the work that you do, how you wound up at CMU.
Here. Super glad I wound up here. Colorado native, and my husband and our 4 kids moved here 2013 from southern Colorado, and have enjoyed the weather in Grand Junction and just being at CMU. When we first moved here, I was and I'm happy to have worked with Mind Springs Health, and then about 4.5 years ago, I think, came over to CMU, and hopefully can stay here forever. It's great. Yeah.
And Mind Springs, for those who maybe aren't from this region, who is Mind Springs and what do they do for our community?
Mind Springs Health is the local community mental health center. They cover 10 counties, so the majority of all western Colorado. They have numerous programs and services, including the mobile crisis team and the West Springs Hospital, the inpatient psychiatric hospital.
We really provide a critical service here on campus. And for those of you out there, and for those of us that aren't as familiar with your discipline, tell us just a little bit about what you do and what are those services that you offer students. Yeah.
It really isn't what we all see on TV. So I received my master's in clinical mental health in 2013 and became a licensed professional counselor in 2015, and also a licensed addiction counselor for the state of Colorado. So my main goal is to meet that person that I'm working with right where they're at with whatever struggles that they are having. My role is not to give advice, to fix them, even to give my opinions, but just to help reduce the significance of distress that they're experiencing. And if they want to, that may be looking at some of those root causes. It also may be looking at some changing in behavior, and just to facilitate that change and be a good support system.
So if someone wanted to come and see you, gave us a little peek into what that might look like, what does a session feel like, especially for someone who may feel a little adverse or go, I don't know if I want to go talk to someone about my problems. Tell us a little bit about what it feels like to access services, and then what does a session look like when they come to see you? Yeah, well, I definitely want to normalize that it can feel very scary to come see a counselor. I don't think we're that scary once you get to know us, but the stigma, unfortunately, for mental health is still very much a reality, unfortunately. So when someone comes to see us, just to start from kind of those basics, again, they'd go to the Student Wellness Center. Calling ahead for an appointment is a great idea. Upon arrival, if they haven't ever seen us, they're going to fill out some new patient paperwork, basic history, just like going to a doctor. Bring your MAV ID, which is important because we serve all CMU students and their minor dependents, actually, so not everyone knows about that part. We will then have either the therapist or a care coordinator
meet with them to do a brief mental health screening. It's about a page long. It's got a lot of questions. And really the purpose of that is just to help us get a snapshot into what symptoms they're struggling with, what's presenting. That helps us really narrow, kind of focus in, narrow down, whatever you want to say, on what's going on so that we don't waste time. Let's get some help going, right? Once meeting with a therapist, again, we're going to really work with wherever that student's at. It's what the student wants to talk about, not what we want to talk about. We can brainstorm some solutions, definitely coping skills. We are going to ask about safety. Unfortunately, with this population and Mesa County, suicide rate is very high. So we will ask about safety concerns. And then just going forward, it's building that kind of trusting relationship, talking about whatever is most pressing. And like Liz mentioned, incorporating a lot of the other CMU supports that we have on campus. So a really nice kind of wraparound support team, I think, is crucial for students. It's also important for us to match the student with a therapist that they feel comfortable with. So just of note, if you've come to the Student Wellness Center and you weren't quite happy with who you saw, please still come back and we'll get you with someone else, because that's super important too.
It's that matchmaking and chemistry between you and the therapist, right? So I think about, Anna Lee, the variety and diversity of therapists that you have, whether those are folks who maybe, regardless, male or female, maybe they specialize in things like grief or maybe trauma or, support for LGBTQ identifying students. I mean, just a variety of things, and you've done such a nice job of providing that. I wonder if we rewind real quickly, when I walk in, correct me if I'm wrong, Anna, but if I walk in, I see the same counter and the same waiting room, whether I'm there for an upper respiratory chest cold or there for some anxiety. So it seems like walking in, I have a less stigma because I might be there for the flu or I might be there for anxiety. So if you and I are sitting in the waiting room, we don't really know why each other is there, right?
That's exactly right. And just having that one stop, that very much integrated care, I think it does help reduce that stigma.
Yeah. And the key issues, I mean, you've touched on it, but the key issues you're seeing students face right now. I hear you talk about anxiety and isolation. What are some of the other issues that are out there, just, in I think, the spirit of transparency, so we're all clear-eyed about how we can best support our students?
Yeah, definitely increase in anxiety and depression. This semester we have seen an increase in suicidal ideation and unfortunately drug and alcohol abuse. I think it is common for a college population to experiment and to maybe socially drink, but there's definitely been an increase of that. Like Liz had mentioned, not only the amount of people that have that we've seen an increase coming in, but the severity. So a lot of, unfortunately, panic attacks and those suicidal concerns. And not uncommon to this semester, though, we continue to see a lot of trauma, whether that's past trauma or more recent trauma that the student is wanting to seek some help with, and that increased isolation and feeling lack of connectedness on campus and just college life maybe not exactly what they dreamed about, as their freshman or, no matter what year it is in college, it's different.
Some of those age-old challenges that we all faced as freshmen too, right?
Right.
Absolutely.
Plus COVID.
Yeah, exactly. And then you had COVID on top of it. That's a big stressor.
Yeah.
It's interesting. I wanted to kind of come back around to the stigma piece because I think that's so important. And I think it's really easy for those of you who may be at home listening in, or for college students here on campus, to think, I have to really have a problem before I go talk to someone. And what I'm hearing you say is, just come talk to someone, and to maybe just help us understand, what does that look like if someone is sitting there and saying, well, I don't know if I really have a problem. What services are there for just wanting to talk to someone, feel connected?
Well, I often ask, what brought you in today when someone comes to see me? Because whatever is distressing to them is distressing to them. It may look very different than someone else's, but it doesn't matter. It's still affecting their quality of life. So if a student doesn't necessarily want to see a licensed counselor, We do have mentors available. We also have care coordinators. Care coordinators, we try to have 3 to 4 each semester. They are upperclassmen, undergraduate students that are in the social and behavioral science study. So they have a lot of psychology, mental health training and teaching that they're going through, and they can provide that peer support that is very much different than a counselor can do. So a student can just come in to just talk with them or another mentor on campus. But even seeing a licensed therapist, we're going to just talk about whatever the student wants to talk about.
Yeah, it's great. Having someone you trust is so important in that. So I love that you have extended those services to our students. Anything else that you feel like our campus should know about what happens and how to access you and your team and really the heart of what you want to provide on our campus?
I really want students and parents to just feel comfortable giving us a call if they have any questions. The information on the website under Student Services for Student Wellness Center has a lot of information, but just call and ask. Feel free to email me. It's great that faculty and staff will email me or call me. They've even walked students over. So again, that campus-wide support, everyone is so on board with getting students the correct supports in a timely manner. So I think just for everyone to really remember that there's no silly question, no silly problem. If it's distressing, if you're concerned, just call us and we'll brainstorm from there.
That's great. And you mentioned that sometimes people will actually walk someone over. It sounds like a referral has been made. Have you had an increase in referrals, and who can make referrals?
Anyone can make referrals, and I do believe we have seen an increase just based on our utilization numbers. Anyone can make a referral. Anyone can also, they can do that through the Report It option, which is available through MavZone and on our website. So
this is the little yellow banner
little yellow button.
that you click on
it.
Click on MavZone, right?
Exactly. Yeah, and you can fill out as much information in there as you want. It can even be anonymous. So that's a great way to refer a student. Encouraging the student to call. So maybe a parent or faculty, anyone, a friend is sitting with that student who's struggling. Maybe together they can call us. I'm happy to outreach students as well. So if I get a concern email or a concerned parent calling, again, we can reach out to those people.
That's great.
Anna, your team and your work is so vital. We just can't thank you enough for that. And I think a great reminder for all of us that your team is working actively, supporting many students. It's a great resource and available for folks who need it. Again, they can call, they can visit the website, they can email. Just need to take that first step of reaching out.
Just take those first steps. And I encourage everyone to have available those crisis phone numbers, Colorado Crisis Line, but also the National Crisis Line. So wherever a student goes over break, those resources are available, and it's really important to stay connected, especially locally if they're able to, or we do have those telehealth options as well.
Yeah.
Yeah, we're talking a lot about these action plans and getting ready to pivot towards going home. Maybe send us away with some health and well-being advice and tips and tricks that could be a part of that plan as we're thinking about reentry.
Yeah, heading into the holidays.
That's right.
Yeah. Well, still eat all the yummy holiday food that you can. Hands down.
Love that advice.
I've got a prescription for pumpkin pie. That's
and
good
most
news.
gyms are closed, so no,
That's
I'm
right.
kidding. I would really encourage students to, after Thanksgiving break, don't forget we have 2 weeks left. So stick with that routine that they've established here as much as possible. When you're supposed to be in class, try to be online and do some homework. It kind of just having that routine can get you through those last 2 weeks. If you had an exercise routine, try to keep that going. Once school's done, I still encourage a routine. And not that you have to be so rigid about it, but those things that you need to do weekly or even daily, make sure you do those. That's going to facilitate just continuing our continued wellness. Staying connected to people, it's challenging enough as is, but if we're apart from our friends, FaceTime. It's different than texting. We can see them at least. Schedule those times to connect with our friends, and hopefully, some short-term goals can be set and even accomplished over winter break. We have a break from school, so maybe we can focus on some other things, and being creative as well. I think that would be the last thing I'd mention is the normal ways that we would relax and de-stress may not be or may not look exactly the same as they used to pre-COVID, right?
Yeah.
So stay creative with how you can still do that. Might make some new memories and some fun experiences trying things out too. You never know.
Absolutely.
Anna, so grateful for you to come in and chatting with us today, and visiting with all of our students and parents and others at home. Thank you for your good work.
Thanks for having me.
Appreciate you.
Absolutely.
Yeah.
So, Dr. Bronson, we're starting to get some questions
Okay.
in the
right
panel
in.
here. We'll transition into our Q&A session.
Right. I think one of the questions, we started out the segment talking about we're starting to see numbers rising in the community.
Yeah.
We're seeing numbers rising here on our campus. I think some of the questions around what happens, and are we thinking about that we may have to send students home sooner? We're 2 weeks out.
Yeah.
Are students going to stay here, or are they potentially going home a little sooner?
Context matters, and I think going back to our dashboard, we anticipate that our numbers are going to grow significantly this week. But if you look at the context, to this point, overall campus burden has been less than 1%.
That's right.
I expect we'll crawl over 1%, maybe even 2% this week, but 2% out of 10,000 is still a very small number.
It is.
And so one of the things that I would point our campus community back to is our trigger construct of green, yellow, orange, red. The county and the state have ramped those dials up a fair amount because they're having things are running. We have a different situation on this campus though, right? Because we have 172 or 174 isolation and quarantine beds.
Yep.
I suspect that we won't be much more than 10 or 15%
Yep.
of that, meaning we're not even close to half of those beds being
Yep.
utilized. We're continuing to get people tested in a very timely fashion, often under 24 hours.
Yep.
We're often getting those results in a short amount of time. And then contact traces and notifications are happening quickly, right?
Yep.
So as we think about what our capacity looks like, I think for us, we would think about, well, what's that point where we start upgrading our concern, our campus alert level?
Yep.
And it really comes down to our capacity, right? And the stress on the university's capacity. So as I sit here today, I don't like the fact that our campus cases are growing, but we talked about acuity, we talked about severity.
Yep.
Those things continue to stay low. And as we sit here today, it appears to me that our campus ability to respond, we're continuing to stay on top of that.
That's right. And I also think it's important, as we have really dove into the data, when we look at 3/4 of those that are, a part of our campus community that have tested positive are not living here on campus. And so our ability to be able to respond to really the campus burden that we have here on campus, that doesn't mean that we're going to change any of our policies and protocols that we're doing as far as mask wearing and social distancing. If anything, this is our sort of address to everyone to say we have to stack hands on making sure that we are doing all of those things, because that's what's going to get us across the finish line together.
It's a marathon.
It
I
is.
think we're all fatigued. The mask wearing and the distancing and everything is tiring all of us out.
Yep.
But what we know is we have got to double down on those efforts over these next couple of weeks.
That's right.
All that said, I think the short answer to the question that we were posed is, will we be heading home early? As long as we can continue to manage testing, tracing, isolation, identification, and being able to get students in a safe place, get the care that they need.
That's right.
I think that fits into this, some version of we're able to manage it in an effective way.
That's right.
And so we would not send students home early in the next 2 weeks.
That's right. One of the management pieces that we hit on, and you talked about at the beginning, that we're starting to expand how many wastewater sampling sites we're having, because that's been a really effective tool. Maybe we could talk just a little bit about the conversations we've been having over the last few weeks about how to potentially expand that out to our community. And is that a good science for some of our community members to have that same tool in their tool belt?
Yeah, looking at campus as a example, I think we can see we don't monitor academic buildings. We don't
Right.
monitor administrative buildings because if you without getting too graphic, if you think about what is successful about effluent and wastewater testing, it's residence areas.
That's right.
And so residence halls lend themselves really well to this. So if you extrapolate that out into the community, we have thought about this pretty substantially with our friends at the school district.
Yep.
It does appear that there may be some, and we're actively exploring this idea of growing out into congregate care, such as assisted living and senior care living facilities, because they are residential,
Yep.
and you stand a really good chance of capturing a community of interest like that. The other upside of that, even though it's a little outside of our wheelhouse, but very much as a community partner matters to us, it allows that early detection among a really high-risk population. So we think
Right.
that there is some possibility to grow into the senior living care, and we anticipate some additional conversations even yet today to help us pursue that and continue to be a good partner with the community, finding ways, any way we can, to help address some of those high-risk populations, in particular our older family and friends.
That's right. And really hats off to our engineering faculty and all the students that have helped to make this possible, because
Absolutely.
it is really their work that is now being disseminated out into our community that is going to make all of us stronger. So,
Yeah, if you have a minute, go back to one of our prior episodes, Dr. Carrie Schultes, Dr. Mellentine, and some others who have just been absolute warriors and both driving this, helping make it possible, and frankly, coming up with the ingenious ways of actually building and designing these systems, right?
yeah, it's very cool.
Very cool.
All right, and talking about optimization, we've talked a little bit about the future is now and what this process is, but we haven't gotten too granular with, are all these committees meeting again that they did when
Yeah.
we were doing Safer Together, Stronger Together? Like, let's dial that back just a little bit and talk maybe a little bit about what is this phase and what is sort of the work groups that are going to make it happen.
Yeah, so Dr. Bronson and I have served as co-chairs, but the reality is that the bulk of this work is happening at a committee level. So Liz Howell, our friend who was on earlier, and Jody Deers are managing things like the student services and the residence life optimizations. We've got a whole nother group dealing with our public spaces, Moss Performing Arts, our athletic venues, our university center, and places where you've got a bunch of public interaction. Each of these groups, and there's more than a dozen committees and dozens, plural, of subcommittees,
Yep.
are getting back together, and they're going over some very basic questions. What's gone well? What has not gone well? What are things that we need to stop doing because, frankly, what we thought would happen in May has not turned out to be true?
Yep.
And what are those things that have worked really well for us that we need to continue making some basic assumptions about where we're at? So that work is happening in real time. The other element that we know will continue to be core to our process is that public health and medical advisory team.
Huge.
And so we've talked about that group a lot. Community Hospital, St. Mary's Hospital, Mesa County Public Health, and others that have all come together to really help us vet each one of these policy choices to ensure that it's putting the university and our students in the safest and best place possible moving forward.
That's right. And that has been the core team that really has made this plan successful. And I think the really fun part about unfolding this plan was also the external partners that we have now been able to add to the team. So
You bet.
we have this medical and health internal sort of advisory board, external medical and health advisory board, and now maybe we could talk a little bit about the community partners that we've added on that are really going to help kind of optimize as we continue to move forward.
Yeah, I mean, we think about the work we've been able to do with testing. One of the things that I think has really helped our relationship with Mesa County is the fact that they've got their hands full right now with community-wide testing sites, probably not unlike you sitting at home today. If you're in Jefferson County or Arapahoe County, Larimer County, you're seeing these same things, right? Your local public health agencies are just breaking their backs to try and operate test sites in both a timeliness as well as throughput that can allow. Well, Mesa County has been in part successful because we've taken the entire campus community and taken that off their plate and done that here. So that partnership has been really important. But what's allowed us to do that is the work we've done with COVID Check Colorado, in partnership with Gary Community Investments in Denver, and bringing different labs to bear, bringing different resources to bear, our scheduling, our software, all the things that have allowed us to do that. And what a great partner they've been. The other element that, my goodness, I mean, I think about the work that Dr. Sabetti and the Broad Institute and the resource that they have served as for us. And, you'd look a long way before you found experts out there with more experience, more worldwide renown and experience in these areas, giving us their best advice too. And what a critical role that's been.
Absolutely. I think about Darwin Biosciences and just the Warrior Lab with now being able to do Yale and Saliva Direct. All of that would not be possible to keep our community safe without the investment of all these external partners.
Absolutely.
So, super appreciative.
Long list of long list of thank yous.
Yep, absolutely.
Yeah.
All right. Well, I know we had one last question about Thanksgiving break, and students are going to be leaving for a long time and they're traveling. Can family come here and help students move out? What's that protocol sort of process going to look like as we're looking a couple of weeks down the road? Yeah,
move out's a good question. So as in years past, we ask students to take the things that they care about, take your valuables, take, some of those clothes that, you want to have over the break, but you don't have to move out your whole room. And sometimes we get the question, well, can I get back in there? And yeah, we can get you back in if you need to, but really let's be thoughtful about what are those things that need to go home over the break with you. And that shouldn't be, it's only half of a room theoretically, so it shouldn't be a whole U-Haul. It is safe. At a minimum, there's going to be 2 levels of security authentication, oftentimes 3. And so students don't need to worry about whether their things are safe. No one's going to be going into those rooms who's not, a housing professional that's working through there. Their things are safe. They're going to be locked down. They'll be secure over that time period. So take the things that are valuable, take the things that you're going to need over that 6 or 8 week period, but you can do so with the peace of mind of knowing that you don't need to worry about that security. And as far as people coming and helping move out, we're going to want to be cautious as we have been in the past. If you need an extra set of hands, if your student needs some help, let us know in residence life, and we can help. But again, I'm hoping that you're not moving any grand pianos or fire safes out of there. So
that's right. It should be hopefully a one-man job.
Should be a one-man job. That's right.
All right. Well, there's a lot happening this week. We'll continue to be in communication. But I just want to say thank you all for tuning in. If you have more questions, continue to send those our way. We'll continue to communicate with what's happening here on campus.
Thank you, everybody.